Good morning. Thank you for joining us this morning. We're delighted to see so many new folks to the Environmental Professionals Network morning breakfast, as well as some longtime participants. So we welcome you today. My name is Jeff Sharp. I'm the director of the School of Environment and Natural Resources, and we've been hosting the EPN for about 6 years now. We're so excited to have a program today in partnership with the Ohio Hospital Association and a number of delegates in the audience from the Environmental Leadership Council. I want to acknowledge Nolan Rothschilling, Energy Program Director for the Ohio Hospital Association and an SENR alum, for working with Joe Campbell to set up today's program. We will acknowledge Lauren Cook's role in organizing today's program in a minute. We want to thank those of you who elected to sponsor a student through our online registration. This is a new feature this autumn semester and helps cover the cost of registration for students in attendance. Please turn to the back of your program and read the professionals in the audience today who chose to sponsor today's participating students, who along with the School of Environment and Natural Resources and the Office of Energy and Environment, have made registration free for all the students attending today. If you have questions about sponsoring a student, then please see Joe Campbell or Molly Berger after the program. One of our goals with the Environmental Professionals Network is to really help launch the next generation of environmental professionals into the workforce, and your participation in helping sponsor a student and spending some time talking to our students is much appreciated. If you're a student or graduate or undergraduate, please stand and wave your hand so we can just sort of acknowledge who's here amongst us today. If you're a professional that'd like to sort of pass on a few words of wisdom to the students, please step up and talk to them. Also, if you're looking for talent, I'm sure some of them are on the job market or will be soon, so please take the time to visit them. One of the students in the audience today, right up here up front, is Kate Gorman, who is part of the team that welcomed you to the registration table when you arrived this morning. Kate is an SENR student ambassador and forestry, fisheries, and wildlife major. Thank you for your assistance today, Kate. In what free time she has, she is vice president of the Women in the Outdoors student organization, and as it relates very much with today's breakfast topic, she is the director of sustainability for the Blueprints for Pangea student chapter here at Ohio State. I think it's worth sharing some of those details with you today about that organization. Essentially, Blueprints for Pangea is an organization that collaborates with local hospitals to collect their unused supplies and then dispense them through the main organization headquarters in Ann Arbor, Michigan. Their purpose is to work to lessen the disparities between countries that lack basic medical supplies. They accomplish this by working to send surplus medical supplies from the U.S. to countries in need. Blueprints for Pangea at Ohio State is seeking to partner with clinics in and around the Columbus area to collect unused medical supplies that can then be sent abroad. The OSU chapter has an executive board of 7 students and a general body of approximately 30. They have a set of committees focused on fundraising for the organization and meeting its expenses. They do outreach for the hospitals and here at Ohio State University, and to ensure projects are sustainable and accountable. Kate's role in this organization in particular is to minimize the environmental impacts and to raise awareness of how climate can affect health and to advocate on the importance of sustainable practices. Kate, can you please stand up? I believe you will be... Kate will be speaking later today at the Ohio Leadership Council of the OHA, but a request to those of you with hospitals or from the healthcare industry, step up and visit with her about their program. She'd love to tell you about what they're doing and how you might get involved with that activity as well. One final item of business before we introduce today's breakfast program. I want to personally welcome all of you newcomers to the EPN, and as a reminder, the only way to receive EPN notices of the monthly breakfast is through signing up. So take the time to sort of go to our website and sign up. We'd love to sort of welcome you into the community. If you haven't been part of our network before, we have a monthly breakfast, and we think the program covers a wide array of sustainability and environmental issues, and we'd love to have you join us in the future. Also, students, thanks for attending today, and I hope you've had a chance to visit with the professionals at your table. Now into the program. I'm curious to see how many SENR alums are currently in the room today. Do we have any SENR alums? And how many OSU alums? Well, it's great to see a large number of you. One thing we're so delighted to is sort of to see our alums launch out in the workplace and come back and do great things. I wanted to mention Nolan Rothschilling a bit more. We are always proud when an alumni of the school attends the EPN breakfasts and then goes out into the workforce, and Nolan was actually part of this network back when he was a student here, and we love to see him return in the role he's in. We're also excited to welcome Lauren Coch. Lauren earned a dual master's here at Ohio State, an MA in Public Policy and an MENR, Master of Environment and Natural Resources at Ohio State University, while she worked for the Ohio State Wexner Medical Center in the Pharmacy Department. Lauren is currently the Associate Director for Climate and Health Program at the Healthcare, Director for the Climate and Health Program at Healthcare Without Harm, where she focuses on mitigation and resilience initiatives. I'm having a hard time speaking today. I don't know what it is. I biked in this morning and it was a little bit chilly, and maybe it's just I haven't quite acclimated to the cold, so I apologize for that. She will provide an introduction. Laura will provide an introduction and set the context for today's program. Please join me in welcoming Lauren Cook.
Thank you. Good morning. So just a minute about the organizations that I now work for. Healthcare Without Harm is a nonprofit that has been working to really transition the healthcare sector to a more environmentally sustainable practice worldwide. Practice Green Health is our US-based membership network where we work with hospitals to bring them best practices, resources, and really connect them with like-minded hospitals to get the work done. So I was really thrilled when Joe Campbell approached Nolan and I about presenting on this topic because it's not a well-known topic. It's not a well-known topic in the environmental mainstream, and it's not a well-known topic in the regular mainstream. And that is a disservice to all of us because what research is showing us is that the health message is a cross-cutting message when talking about climate change and environmental action, which is a perfect fit for hospitals. So, unfortunately, we've had some really tough headlines over the last just few months. We're seeing more extreme weather because of climate change, and hospitals are really on the front lines of this. They have to have their ERs ready to go. Power has to continue to the buildings, and they have to be able to accept patients, so they have to work with their communities to ensure that transportation is still moving. We also had just some devastating news from the UN's Intergovernmental Panel on Climate Change just last week, a report warning that we have about 12 years to take serious action. So what does that have to do with healthcare? Well, healthcare, it might surprise you to know, in the US is responsible as a sector for 10% of our emissions. So while their mission is to do no harm and to heal, there's a disconnect with the operations of a health system. So anything from the 24/7 energy needs to the food that's served to the massive purchasing footprint of a hospital has emissions associated with that. So healthcare is stepping up. They're following leading businesses, higher education, cities that have really taken on this challenge, and they're saying this has to go beyond. We have to set a carbon reduction goal because as Kaiser Permanente, a health system primarily based in California, their CEO said just last month at the Global Climate Action Summit, this is actually about health. And through our Practice Green Health Network, beyond carbon goals, we're seeing 1,100 of our hospitals that are in this network look at sustainability broadly as a health initiative. So the chemicals that are used within their four walls, the purchasing, looking at the OR as an opportunity to make reductions. We're just seeing lots of exciting initiatives happen in the health sector. And that's really the national perspective. But what I'm excited to tell you about, which you may not know about, is that we actually have a leading hospital association here in our state. OHA has been doing some groundbreaking work in comparison to a lot of the hospital associations in the country. So they have over 100 hospitals participating in their energy and sustainability program, which offers them resources to benchmark against their peers and find out if their energy usage is, above or below that median. They also do advocacy at the Public Utilities Commission on the hospital's behalf. And then they have a group that you heard about from Jeff, the Environmental Leadership Council, that brings Ohio hospitals together to talk about regional issues related to sustainability, to create this non-competitive space where they can share those best practices and learn from one another. And then finally, they also do a recognition program, because who doesn't like to be recognized for the work that they're doing? So we have one of the John Chapman Award winners here today from 2018, Cleveland Clinic, and many Melvin Creeley Award winners in the room. Later, at the end of this program, we're also going to do a recognition for the Ohio EPA Achieving Environmental Excellence Awards. So, without further ado, though, we want to get to the lineup, and we want to hear from the hospitals themselves. So I'm excited to tell you we have a really great lineup, 3 distinct case studies from different sizes of institutions looking at this work through different lenses. So I'm going to skip the full bios, but you can actually look on your pamphlets if you want to learn more about each of them individually. But from left to right, and this is the order that you'll hear these speakers in, first we have James Evans, who's with the Office for a Healthy Environment at Cleveland Clinic. Next, we'll hear from the CEO of Barnesville Hospital, Dave Phillips. And then finally, we'll hear from Aparna from Ohio State University Wexner Medical Center. So it's my pleasure now to turn it over to my friend and colleague, James Evans.
All right, good morning, everyone. Thanks. It's really, really good to be here with you guys in Columbus. I don't get to make it down here that often, but it's just great to be here to talk about sustainability at Cleveland Clinic. For those of you that do not know, 95% of Cleveland Clinic's footprint is in, you guessed it, Cleveland, and we have about 12 hospitals up there. We just merged with a couple of new health systems down in Weston, Florida. We have a facility out in Las Vegas. We have a hospital in Abu Dhabi, and we are also opening a hospital in London in 2020. So we're rapidly expanding. We've grown a significant amount in the last 10 years. We have about $8 billion in revenue, about 52,000 employees. We call every one of our employees caregivers. It's really a culture building exercise that started about 10 years ago with our former CEO, Dr. Cosgrove, because we are all involved in patient care, regardless of whether we're on the clinical or non-clinical side. We have about 7.1 million total visits every year as well. And we have one of the highest, actually the highest, we're number 1 in the country for average case severity. So we really treat the sickest of the sick patients. We have about 220,000 admissions every single year. And really, when you're treating the sickest of the sick, that requires a significant amount of resources. As you know, healthcare is a very complex industry. We're open 24/7, and we're really treating these patients, and we need to make sure that we're obviously taking care of the amount of resources that we're using. So the World Health Organization estimates that 25% of global deaths are caused by environmental factors. That's 1 in 4. In the United States, it's a little bit lower. It's about 1 out of 10. And really, one of those leading factors is air emissions and all of the health effects that come from air quality. In Cleveland, we're actually ranked 10th worst in air quality for particulate matter, and so, this directly impacts all of our patients that are coming into our facilities each and every day. And so, really, collaboration matters in healthcare, in this massively complex industry. And so at the federal level, we have partners such as, Lauren at Practice Green Health. We work with the White House. We work with the Department of Energy. At the state level, we're working with the Ohio Hospitals Association, which has been just a great partnership for us. At the local level, we work with the City of Cleveland, our area-wide coordinating agency, NOACA, and a bunch of other partners. So this is all just a very collaborative effort in healthcare and sustainability. And the opinions of our stakeholders really matter in sustainability and to the organization as a whole. And so there's a lot going on in this chart. And we report out through 2 transparency bodies, the United Nations Global Compact and the Global Reporting Initiative, which are 2 frameworks for sustainability reporting. And in 2016, we underwent what's called a materiality assessment, where we went out and we interviewed 30 different internal stakeholders and 30 external stakeholders from all of those partners that I listed on the previous slide. And we asked them, what matters most to you? What matters most to our relationship with each other? And what can we be doing with our resources to focus in and truly make an impact in? And so if you look at this chart, you can see that there's significance to external stakeholders on the vertical axis and significant to internal stakeholders on the horizontal axis. And so we ranked each topic throughout those interviews on a scale of 1 to 7, 7 being the most important, 1 being the least important. And so if you look in the upper, I don't know if there's a laser on here, there we go. These are all of the tier 1 topics which were most significant to both external and internal stakeholders. So if you look, you can see that a lot of the green bubbles are really all the sustainability initiatives. The yellow or orange bubbles are the community initiatives. The purple, internal caregivers, and so on, governance, and then patient issues. And so this really helped us to map out what we should be spending our resources and time and energy on. It's just a great kind of strategy map for our office and for our organization as a whole. So, last year, our office celebrated 10 years of sustainability. We started in 2007, sorry. And we wanted to set out bold goals. So The Lancet is a very well-respected medical journal, and they said that tackling climate change could be the greatest global health opportunity this century. Lauren just mentioned that the IPCC is saying we have about 12 years to take meaningful action. So our biggest bold goal last year at our 10-year anniversary is we wanted to set out new goals for the next 10 years. And we felt that carbon neutrality is probably the biggest thing that we can do to really help us get there. And so we committed to becoming carbon neutral by 2027. And we're just really happy about that. And there's obviously 2 ways that we can go about getting there. There's on-site generation through solar and wind, and there's also off-site generation through financial instruments pretty much known as power purchase agreements, and I can talk about that later. So how do we get there? We have a new construction standard where all of our new construction is standard to LEED Gold. And it used to be that we just built to LEED standards, but we have now a new chief design officer who is really striving to hit that LEED Gold mark for every new construction project. These are the amount of LEED certified buildings that we currently have in our portfolio. So 3 that are certified, 11 that are silver, and 5 that are gold. We're also currently about 90% of the way done through implementing the largest LED retrofit in healthcare. So we've done about 400,000 tubes. We've used 4 different installation vendors, 2 of which were diverse through a local partner known as Evergreen Energy Solutions. And 2/3 of those tubes are actually made literally about 30 minutes away from our main campus in Solon, Ohio. And we've created about 25 local good paying jobs throughout this project. And so here's where we are in terms of our energy intensity reduction. So for those of you that aren't aware of what energy intensity is, really when you look at this chart, all this is saying, let's add up all of our electricity and natural gas use and turn that into what's called kBTUs, and you divide that by the square footage. That's all this really is. And so this is what we call our EUI. And weather normalized source really just means that it's kind of the algorithm takes into account weather and really where the energy is coming from all the way back to the source. So you can see our 2020 target is down around 400. We started a little over 500, and we're currently down 17%. And our goal is 20% by 2020. So we're almost there. We've got a few more percentages to get to. And go hand in hand with energy efficiency is carbon intensity. And so we started measuring our carbon footprint, I think 5 years ago. And again, in the blue bars here, this is actually the total metric tons of CO2, and then that purple line is the total tons of CO2 divided by our square footage to get the carbon intensity. And we are down 25% over the same period from 2010 to present. Also, Cleveland Clinic and Healthcare itself has a really, I'd say, diverse waste profile. So we track 35 unique different waste streams. And I didn't put the legend on here. It's actually in our sustainability report if you really want to go out there and see. But we track 35 streams, everything from trash all the way through all of the regulated medical waste, metal, cardboard, silver from x-rays. I mean, it just goes down the list. Healthcare is a very complex issue. It's not just, commingled cardboard. There's a lot of other waste streams that we track and try to improve upon. So this is where we've been, and this is currently where we are in 2017. So we started down around 10% at our main campus in terms of landfill diversion, and now we are up well over 35 to 45 depending. And these two different lines really distinguish between what our recycling rate is without construction and debris, because we do a lot of construction, new construction builds, and without that. So those are the two differences between purple and blue. And then everyone always asks, how do you get the most buy-in? And it's usually when you're saving money for your organization. We're always looking for that triple win, right? You're looking for what's good for the planet, what's good for your organization, and what's good for your caregivers or your community. And so you can see over time, for our 10-year anniversary, we wanted to know, how much has sustainability at Cleveland Clinic saved? And you can see that these are cumulative savings from 2007, and it just continues to grow, and we're up there around 90,000, or 90 million, sorry, I apologize. So sustainability does save. There is a significant ROI for sustainability. And lastly, we do a lot of advocating for health as well. So you can see here are some of the events that our physicians have taken part in, and I've taken part in as well. Dr. Koch, who's a pulmonologist, she hosted the former EPA Administrator Gina McCarthy to talk about air pollution and health. Bill Peacock is our COO. He was at the White House with an architect to talk about resiliency and building a climate resiliency plan. Dr. Gordon, who's our champion in greening the labs, hosted the Department of Energy at one of our facilities to talk about the energy efficiency work that her department has helped out with. And then here you can see Dr. Sullivan with the Ohio Environmental Council in 2017 talking about climate change and health. We also really try and make a big impact in our communities. So this was a tree planting event that we did with a local community called Fairfax, where we planted, I think, 100 different trees in this park and 3 different pollinator gardens. I actually last week was just also doing another tree planting event in the same neighborhood. So, sustainability is an interesting place. One day you can be making a presentation to the COO in your suit and tie, and then the next day you're digging through trash at a hospital, or the next day you're in your jeans and you're planting trees. So it's a really unique space to be in, I think. And then lastly, we really try and message this to all of our caregivers at Cleveland Clinic. So if not you, who? We have these messaging from energy and waste and climate, all of our facilities through all of our TV monitors throughout the entire system. And really this is the kind of culture that we're trying to drive home. So we have all of the caregivers that are involved in sustainability at Cleveland Clinic. We call them eco-caregivers. And really driving this culture is what's enabled us to, I think, see the results that we have over these last 10 years. And then if you guys have any questions or you're really looking for more information on any of our programs, I recommend you go out to this website, which is our annual sustainability report. It's ccf.org/UNGC. And it's really got all of those buckets that you saw in that initial chart for the materiality assessment for really everything that we're doing. And that's it. I guess I should introduce the next speaker. So here's David Phillips from Barnesville Hospital.
Thank you, James. Morning, everyone. My name is Dave Phillips. I'm the administrator and chief executive officer at Barnesville Hospital. And when Nolan first asked me, if I would present today, one of the first things that I said was, why? I said, you're going to put me in between Cleveland Clinic and the Wexner Medical Center. How does Barnesville fit in there? I'm a chief executive officer. What do they know about, sustainability and environmental efforts? So, I took a step back and we talked a little bit about it. And, my background is, in facilities. I started out, in materials management, went from materials into facilities, ultimately into administration. So I understand, the world that facility directors in hospitals live in. And one of the things for, us that, I wanted to message today was just because a facility is small doesn't mean that they can't make a difference in sustainability and in the efforts, ongoing. Obviously, a facility our size, and I'll give you a little bit of demographic information about ours, is not going to be able to, have an entire department such as, the work going on at the Cleveland Clinic. But there are still differences that we can make, as a facility. So Barnesville, for those of you that, if you're not familiar, is located on the eastern part of the state. We're about 2 hours east of here, right off of Interstate 70. We're a critical access hospital located in Belmont County. For those of you that are not aware, critical access is a status that was put in place back in the 1990s for hospitals that served, an emergent need in a community that without those services, a community would be deficient in terms of healthcare resources. There are 9 counties in the state of Ohio out of the 88 that do not have hospital facilities. We border 2 of those counties, with where our location is at. We employ about 270 individuals in our organization. An annual revenue of 45 to 50 million. In a village that has about 4,000 residents, about 40,000 residents in our entire service area, and then square footage of about 80,000. So vastly different than some of the larger organizations in the state. But so how do we make a difference in what is going on in today's environment? Our buildings were built in 1954, 64, 74, and then not again until 2015. So we face a lot of significant challenges with older buildings and trying to maintain those and bring those up to today's standards. The past 20 years have really been a journey for us in terms of our efforts. Some of the major breakthroughs that we've went through have been in 2015, we put on a new emergency department to our facility. Lighting has been a major initiative and control systems have been a major initiative. With the emergency department, we added on, about 8,000 square feet that when we designed it, we wanted to try and put in as many of, today's standards. We did not get to a LEED certified initiative, but we really tried to put in as many energy efficient fixtures and design as we possibly could, and the team that we worked with really worked hard at that. In terms of lighting, we have also begun to switch over to all LED in terms of our hospital lighting. And then our control systems. As you can imagine, with older facilities, maintaining temperature control, maintaining your efficiencies is extremely difficult with older buildings. But with the control systems that we've updated and put in place, it's made that much easier, made it much more comfortable for the patients themselves. The clicking through here. So what did we accomplish as we were doing this? Lauren talked, a little bit earlier about, some of the recognition. And, the recognition was just a bonus, for us. But some of the things that we have accomplished, our Energy Star went from a dismal 19 up to a 99. Well, how did we accomplish that? A lot of it had to do with that emergency department and the work that we did there. When we were able to add that new square footage, it really made a significant difference. We went from a 19 to a 50 to a 99, over the course of a 3-year period. The Ohio Hospital Association has their Energy Cup, which is a competition between different categories of hospitals. We fall into the small category, obviously, that deals with energy savings. And we were in 2016 able to achieve that Ohio Hospital Association Energy Cup Award. We were the ASHE Energy Champion in 2017. And a lot of that has had to do with our energy savings, that has also resulted in cost savings and overall patient satisfaction. With the initiatives that we've done, we have actually reduced our energy footprint. We have saved money in the process by doing so. And our patient satisfaction has remained at an extremely high level for the patients that we serve, not only in terms of the care that we provide, but also in terms of the environment that we're providing the care in. Really, the only complaint that we get from an environmental standpoint is noise. Healthcare by nature is a noisy environment. That's been an area that we have struggled with and continue to work to try and improve. So, who accomplished it? Well, what I can say is it's not one individual person. In every facility, it takes a team. It has to take commitment from the top. Our prior CEO, prior to myself taking over, was always very supportive of any efforts that we tried to put forth, in terms of, whether it was green initiatives, whether it was energy savings, cost reductions, changing lighting, whatever the case was, he was always supportive, in those efforts. And I've continued that in my role, as Chief Executive Officer. And it also takes an internal champion. There has to be someone that is passionate about energy savings, that is passionate about sustainability, passionate about all of the things that we all do on a daily basis, but you have to get others to buy into it as well. It also doesn't hurt to have a MacGyver. Gentleman, on the right of the screen there, actually be, my right hand, gentleman by the name of Wes Doudna. Wes is our maintenance supervisor at Barnesville Hospital. He is a genius, in my opinion. There is nothing that he is not capable of doing. And I'll give you an example. We had a situation a few years ago where we had a piece of radiology equipment. We were having continued problems with it. Major manufacturer brought in, service individuals, could not figure out what was wrong with it. On the phone with, engineers in Europe, could not figure out what was wrong with it. Wes finally said, mind if I take a look at the schematics? Gentleman with just a high school diploma. Mind if I take a look at it? And the engineers said, go at it. We've been at it for 7 days, can't figure out what's wrong with it. So, Wes took the schematics, went to his office. About 20 minutes later, he called me and said, I'll be back in a few minutes. He left, he went to the local hardware store, he came back with a 20-cent fuse. He walked over to the equipment, changed out the fuse, equipment fired up, and it was ready to go. General Electric should have paid him, in terms of the work, but he is just, like as I said, it has been a genius for us, and there's nothing that he hasn't been able to piece together in a more efficient manner in his work. Whether it's changing out, fan motors, for something that is going to consume, less electricity, to, trying to change out lighting fixtures. And he's one that, when I say, let's, remodel a certain area, he's the first one pointing out to me of, well, if we do this, this, and this, here's going to be the benefit in doing so. So it's really been beneficial to have someone, that internal champion within an organization, that is pushing these initiatives, not because just the buzzword, not because it's, the in thing to do. It's been something that he has done, his entire career with the organization. We also, didn't do it without help. Outside of Barnesville Hospital, we would never have been able to accomplish what we have accomplished with Energy Star, with energy savings, without the help of a lot of different organizations. The Ohio Hospital Association, Nolan, his predecessor, Rick Seitz, have been very instrumental, and I urge you, if you're in a hospital, if you haven't tapped into those resources, I would definitely encourage you to do so. Energent Solutions, a partner of the Ohio Hospital Association, they have been tremendous in terms of bringing expertise and resources to the table for us. AEP Ohio, you go back many years ago, and hopefully I don't offend any utilities in the room, but you go back many years ago, it was somewhat adversarial, between the utilities and the end users. We have not found that to be the case, in recent years with American Electric Power. They've not only helped fund us, with some of our initiatives, with some of their grant programs, but they have also just been very supportive, brought resources out to help us, in a lot of our efforts. And then PCS and Manage was a construction management firm that we utilized when we built our new emergency department. Their primary office is out of Cleveland, but they also, have offices locally to our geography. And they were also very instrumental in helping us design something that was going to be energy efficient and, make the difference that we were trying to make in the community. So what I would end with would be small's not a good reason. I hear people say sometimes, well, we're small, we can't make a difference. And the message that I would send is that's, not, the case whatsoever. You can make a difference, in your community and in the world just by, small efforts. It doesn't take, multi-billion dollars worth of efforts in order to accomplish change within the community and in the world. So thank you very much, and I will turn it over to our next presenter. I think they're bringing up your slides now. Dial? Aparna. Miss Aparna Dial.
Okay. It's moving on the screen like rapidly. Okay, I'll let you do this, Sam. So, good morning again. It's always a gathering of friends when I come back to EPN, and it's always a pleasure to be here. So the purpose of my presentation is really twofold: to give you an update on the progress we're making at the Wexner Medical Center in terms of sustainability, but where the mission of EPN is concerned, it's really to contribute to this dialogue about how we can further accelerate the commitment to sustainability within our own respective institutions. So I can't talk about the medical center without talking about the university. Can you hear me? So we are very much an integral part of the Ohio State University and very much an academic medical center. We have about 7 hospitals within our umbrella, and revenues half of what you guys do at Cleveland Clinic, about $3.7 billion, and over 29,000 caregivers, so it's exactly almost half. According to the U.S. News and World Report, for the 26th year in a row, we have been rated one of the best hospitals in the country. So we have 10 specialty areas that fall in the top 26, and that's less than 1% of the hospitals around the country can say that. So very much a teaching hospital, very much ingrained with the community. So back in 2005, we established the Campus Sustainability Office, and then we also have a President's and Provost Council on Sustainability that ratified university-wide sustainability goals in 2015, and they are in the area of teaching and learning, research and innovation, outreach and engagement, and resource stewardship. Within resource stewardship, we have goals that range from carbon neutrality to buying local to ecosystem services, zero waste, energy reduction, water conservation. And why am I talking about the university goals? It's because the university goals are the Wexner Medical Center goals. Like I said, we are very much tied together, and anything that we do at the medical center is in alignment with the university and is to further our institutional goals. So we are dedicated to evolving a culture of sustainability, even at the Wexner Medical Center, through responsible use of human, fiscal, natural resources, and reducing the impact of our day-to-day operations. We have quite a big footprint. So I'd like to say, where the Med Center goes, the rest of the university goes, because we are such a huge generator of carbon emissions and, waste. So we have a sustainability council for the medical center, which is made up of leadership across all the different units of the health system, and they're responsible for creating policy and giving guidance and formally adopting goals. And we'll talk more about that later. But sustainability to the Med Center, even though we've been part of a university, has not been a focus, but for the last 10 months or a year or so, really a concentrated focus. So part of my mission is not only to tie our sustainability initiatives for the Med Center to the university goals, but also to the medical center strategic plan, in order to help move this culture along and help our leadership identify better with it. So we have 6 strategic plan goals of resource stewardship, healthcare delivery, research, education, talent and culture, and healthy communities, of course. So what are we doing in this arena? So we recently invested $7 million in some of our existing hospitals to upgrade the interiors for them. How many of you have been to Doudna and Rhodes Hall? Very much needed upgrades. So to give them a new look, give them a contemporary feel. So in the past, a lot of the materials, as we would have upgraded our spaces, would have gone to a C&D landfill. So we created these new environmental branding guidelines, which were our strategy that looked at these renovations through a sustainability lens. So when we pulled out the ceiling tiles, we made a deal with the manufacturer to send it back to them to be made into new tiles. When we pulled up the carpet, we sent it back to the carpet manufacturer to be recycled. We used low VOC paints, water-based paints actually, did LED retrofits, which have been going on across the institution since the 90s. Upgraded it for these spaces. We used the existing handrails and corner mounts. Thoughtful about it. You see equipment rail in one of the pictures. What that does is we put medical equipment on there, so if stuff has to be repaired, discontinued, serviced, it's minimum disruptions to patient care or to the room. And the flooring that you see, the 2 examples, one's the old flooring, which required stripping and refinishing. We went to marmoleum flooring, which is 97% natural materials, has 43% recycled content, and does not require any of that. And we switched to over 90% Green Seal certified, Ecologic certified cleaning for all of our spaces at the hospital. So this must look familiar to those of us in the healthcare business. This is one of our warehouses at 610 Ackerman. So there was a project that said, clean this out. You're laughing, Theo. So maybe in the past, not sure how this would have been handled, but we have an organization on campus called Surplus, where we send about 24,000 pounds of material to them that they usually resell or redeploy within the institution, or the recycle. We dedicated 19,000 pounds of wiring and light fixtures for reuse. Really manage this as a zero waste project, which means diverting 90% or more away from the landfill. And we also sent about 17 tons of material to Guatemala. So we had people that were pulling, bodies out of the ash because of the volcanic eruption with no personal protective equipment whatsoever. when we sent this, people were so grateful, but this just was like a drop in the ocean with the materials that we send them. But then they had masks and they had Tyvek suits and so forth. And then we retooled our recycling program just from a commingle standpoint. I think, James, you talked about how many material streams we had. So on campus, we have a 2-bin system. But for the healthcare sector, we did not want any piece of paper to go into the commingle bin because of HIPAA issues, patient privacy. So even if it's newspaper, magazines, we want everything in our shredding bins, just so that people see paper and they put it in our shredding bins. And then everything else can go in the commingle bin, and trash, of course, waste in the trash bin. So beyond that, when I've been on campus for 18 years now, about 10 months at the medical center, and I was just astounded to see the quantity of materials that come in through the dock. The trucks, the thousands of pallets we use every month to get materials in, the quantity of cardboard that's generated. We installed a baler, and we bale about 4 tons of cardboard a month from this dock. We're switching to about 100%. We are transitioning to reusable plastic pallets. And Owens & Minor is our big company through which we get 90-some% of our supplies. And they used to come in from Cincinnati. With the partnership, they created a new warehouse, built a new warehouse in Hilliard. So now it's about 15 minutes away. So significant reduction in terms of carbon. We also received grant funding to start a composting program within our kitchens. Not to put you on the spot, Mary, how many meals do we serve a day? 10 to 20,000 meals a day. So with this grant, we hope we are going to compost our pre-consumer food scraps and all of our coffee grounds. We are big coffee drinkers on this campus. At full implementation, it'll be about 100,000 pounds of just coffee grounds. They'll be composted along with about 50,000 pounds of pre-consumer food scraps. We are pretty efficient in terms of how much waste we generate in our kitchens. That's why it's not such a huge number which is a good thing, but we have an agreement with the composter to bring some stuff back so we can use it in our gardens here on our campus. And in terms of energy conservation, we are participating in the Energy Cup, the Energy Star benchmarking. We have a LEED Silver standard that we've had on campus for a long time. Our James Cancer Center was a LEED Gold building, but we do setbacks in our OR when they're not in use to conserve energy. We had a whole print reduction initiative where we printed in 2017, we had 109 million imprints at the medical center alone, and we achieved a 2.5% reduction down to less than 106 million imprints and some cost savings. And our data center folks, our IT folks, have done a lot to conserve energy in our data center. They started by measuring how much each piece of equipment was using, so they know where the opportunities are, and they did something called, don't ask me any questions about this, hot aisle containment, so that the cooling needs are very reduced. So they started increasing temperatures in our data center safely without hurting the equipment. So they went from 68 degrees Fahrenheit now to 78 degrees. And they've saved over $700,000 over the last 4.5 years. And just last year alone, it was close to $100,000. And they said they can still up the temperatures some more. And we practice green health. Lawrence done seminal work in this area. OHA, James talked about it. David's talked about it. We can't do this alone. We continue to learn from leading hospitals and MacGyvers. We have a ways to go, but every year they submit a benchmark report. There are many strategies that are best practices in an OR. Typically in a hospital, they generate 30 to 40% of the waste stream. They're the biggest user of supplies. So we do quite a bit of, we are doing some good things, but we have a lot of ways to go. So one of the most excited things I'm looking forward to is we're kicking off a Greening the OR task force next week to look at further opportunities. So things we do well, we do single-use device reprocessing. So what that means is instead of throwing it after one time, we sterilize it for certain types of equipment and reuse it. We do really good job of segregating regulated waste from the general trash because that's about 5 to 10 times more expensive to dispose of. So we do well on that. We use rigid containers for sterilization instead of blue wrap, which generates a lot of waste, and so on and so forth. But we still have a ways to go. And I think we look to some wonderful examples like the Cleveland Clinic to do better. And so where did all this take us? We were at a 23.5% diversion rate in fiscal 17. In fiscal 18, we are at 28%. And that's pretty respectable growth in 1 year. And talking about the triple bottom line, with minimal investment, just in last fiscal year alone, we generated about $1.8 million in savings to the bottom line. And I wanted to give out a shout out to Brian, and Paul probably had to leave. Like your eco champions, we have the green team to generate enthusiasm at the grassroots level for sustainability. There are eyes and ears on the ground. We have over 300 green team members. And we started 3 new initiatives, and a 4th one's just about to kick off just because of these green team members. Education is really important to us. As an academic medical center, we've had 3 sustainability-themed grand rounds. These are lectures to medical students primarily and practitioners. Just last fiscal year alone, we have very robust now material disposal guidelines. So anyone who's been at the basement of Rhodes and Doan, has anyone been to the basement? They call it the Red Sea. You'd find abandoned pieces of broken furniture or equipment because people just didn't know what to do with it. So they're like, let's put it out in the basement. You know, and the facilities and EVS folks has to deal with it. So now if you have a pen, a filing cabinet, clinical equipment, a chair, it doesn't matter what it is, we have guidelines on how to dispose of it appropriately through appropriate channels. And there we started a website. We have a web page dedicated to sustainability. There's an email, sustainability@ocumc.edu, if you have questions about it that you can communicate, and we highlight sustainability stories. Now it's part of our orientation. All of our orientations are now zero waste. We had our very first one last night. Graham told me we achieved 87% diversion from it. We have educational materials that we put in the packet so employees know what they can do, what actions they can take not only on our campus, medical campus, but also at home. Now we have sustainability material on rotation in our digital signage. Lobby areas, patient areas, nursing stations, which are, again, another opportunity for education, and community health impact. So the Wexner Medical Center partners with dozens of organizations to impact the health of individuals and communities across the world. Last year, we spent about $250 million in this effort, whether it's infant mortality, to the opioid addiction, to obesity, but I'm highlighting 2. Anyone know where this picture is taken? It's our Hope Garden right here on Waterman campus. And we started that in 2012, and it's primarily dedicated to cancer survivors and their caregivers. And they can get hands-on experiences. They share a nice meal. They get educated about foods that have cancer-fighting properties. Mary, you want to add something else to that? This was one of your passion projects, I know. Shows comes. In this program. And then the other program that we launched just in May of this year is our mobile food education truck as a result of a $500,000 grant from Judy and Steve Tuckerman. And we are very, very proud of that, and it's staffed by chefs as well as dietitians, and this truck travels all around the state to community festivals, and again, talks about healthy eating, resources, and all of the research that backs up these findings as an academic medical center. So just incredibly proud of that. So where are we going next? We do a wonderful job of offering over 1,000 courses related to sustainability every semester on our campus. So I have conversations coming up with the College of Medicine to say, what can we do from a sustainability curriculum standpoint there? Maybe there are some partnerships available for offering certain courses. Don't know. That's an opportunity. We are looking for formalizing a donation policy. So we'd look forward to working with you, Kate, and see what resources you can provide for us to help make that an easier transition. We just started a sustainability group. We have the very first one in the College of Medicine. So we are looking forward to working with them. And then we have fiscal year 19 goals that I'll send out that can be shared, but it's everywhere from what food we serve, what chemicals do we use, how do we green our supply chain, where are we buying products from, what are we putting in our interior. So again, it's wonderful to be able to celebrate these accomplishments, but we have to keep moving forward and work to take advantage of this momentum that we generated and learn what we can from the wonderful things you've done, David, to see how your Energy Star scores went from 19 to 99, to your track record of being the John Chapman winner, and all the work you guys are doing. So we still, we're doing a good job, but we have a ways to go yet. And I look forward to coming back with some better news and bigger achievements in the near future. So thank you.
Okay, so we'll invite the full panel back up to answer questions.
Say when. Just Joe, I'm not sure this is working. It is? Okay. When people go home as an outpatient or from a hospital, and I know it's a challenge, they have a lot on their minds, the caregivers, their family, but still, I'm wondering if there's opportunities for you all to share with them highlights of sustainability that you're accomplishing, and then what they can do at home, back in their community, but in their own home, day-to-day living, and maybe disposing of prescription medicines that they don't need any longer. But a short list for sure. You can't browbeat them in the condition some of them may be in, but still, I think there's opportunities for you to look good in the minds of the patients of all the great stuff you're doing sustainability-wise, and encourage them to engage on their own home situations.
I think, David, that's a wonderful thought. We try to set the right example even by the facilities that they come into. If you look at the James Cancer Center, all the materials that we have in there in terms of trying to promote a very natural, healthy environment, helping them heal faster. We eliminated plastic bags that patient belongings are held in. So we have an opportunity to educate and say we are using reusable bins in some of our areas, why we are doing that, as well as I talked a little bit about the digital signs and monitors in the lobby. That's an opportunity, as well as the food that they're eating. We try to very much have healthy local foods and offerings. We have vegan options and things like that. So very much we're setting the example, but to proactively, maybe there's an opportunity in the discharge instructions. I know I keep looking at Mary, maybe, that we send home to slip that in. I don't know. But that's an interesting point, because we focus so much on our employees. But it's all about the healthcare and the healthcare experience for our patients, and maybe there are some more opportunities that we can look at.
I think for us too, it's the same way. I mean, everything right now is moving to digital sort of messaging. So, you know, when you have nurses stations or you're walking through corridors, everything is on just monitors and screens. So that's generally where our marketing and communications departments are pushing us to push our messaging to. And we have what's called scale boards. There's really all of our topics, and they're really simple things like take the stairs or adjust in layers, or, you know, they're really basic things that help us conserve resources here. We hope they take that messaging home as well. We do what's called leadership grand rounds. So at the beginning of, usually I think it's the first Tuesday of every month, we go around to different, really just different departments or different wings, and we meet with specific patients and we ask them questions. And generally when I'm there, I ask questions about sustainability, and we get feedback. I mean, you get everything from what, we don't really care about this, to I love everything that you're telling me right now. So it's both of those things. We also have looked at, instead of like giving, you know, distribution pamphlet materials, you know, with discharges, having like just little table tents in the room, which are like, you know, just mentioning recycling or energy. I mean, it's generally really simple messaging is what our marketing team kind of tells us. They want it to be at like a 5th grade level. It's got to be real basic. So yeah, no, it's a great point.
I would agree, and I think it's something that in healthcare we haven't thought of. A lot of at that discharge point of being able to educate individuals. I think a lot of it is how that ties into their overall health. Because how the food they're putting in their body, what they're doing with medications, all of those things, tie into not only what we do in the hospital, but their overall recovery at home as well. So I think it's an excellent point for us to think about moving forward.
My background is in health and wellness, and I worked for a few years as a home health nurse. And I will say that there is, from my observation and experience in the field, a disconnect between the discharge planning and when the patient gets home. Home health caregivers are kind of the boots on the ground, the eyes and ears on the ground. And oftentimes I feel that there is an absolute need and opportunity in community resources to kind of bridge that space between the home and the hospital. Because even with all of the resources we have in facilities, patients just don't have access to that or means to provide those things. Oftentimes also with the digital and technological age, there is a generational gap with a lot of patients who are needing extended home services. They're not going to log onto the internet and create a profile and look at all these things to follow their instructions. They're actually very much intimidated by that process. So I think having continuity of that care that follows through the community and kind of bridging those gaps between home and the workplace and the hospital and school is essential and an opportunity that can be looked at.
To speak to that, number one, thank you for your work in home health. I mean, it takes a special person to do home health care, and you really see the true environment that an individual, is living in and what may be impacting their health as well. And I think we have to do, an even better job in the healthcare community of being the liaison between all, health providers, because, healthcare, by nature, has been a silo business for many years. We've worked very hard in the healthcare industry to break down a lot of those barriers, but a lot of them still exist. We in our facility have a preferred relationship with a home health provider in the community that, they're part of our care conferences with patients when they're in the hospital. Now once they're discharged, there's not as much work, that goes into that. But I think with a lot of the population health initiatives, that have occurred, that has helped start to bridge some of those gaps. And we also need to do a better job of taking it out to the community. We can hold, conferences and events and initiatives all day long in our facility. We're not going to get, the turnout as when we take it out to the community. And I think that's a major initiative, for a lot of healthcare organizations.
I was just going to say thank you. And there's a lot of evidence that suggests that if there are strong linkages between their discharge and what they're doing at home, the outcomes for the patients are so much better in terms of survival with heart attacks and things of that nature. So I was just at this conference last week, and there was a young gentleman. They had this sort of version of a Shark Tank kind of thing where people were pitching ideas for technology, and then they got funding and they had questions from a panel. And this gentleman that won, his whole notion is this continuity of home care at like a fifth of the cost. So for $1,000 a patient, and they statistically said that their survival rates were like 70 or 80% higher. And it was this just really ingenious idea of using a tablet, because a lot of people don't have the means to come to the hospital for or they're 2 hours away, but having everything on this tablet that they can take home, that they get training on, so doing their physical therapy at home and so forth, and using that. And I thought, wow, that's so a lot of people are thinking about this problem and in this space.
I'd just like to pass on a gentle suggestion when you are looking at your supply chains to also look at your construction projects. About 10 years ago, I was at a meeting at US EPA in Chicago. We saw a really interesting presentation about how one of the major hospitals in Boston was doing a big construction project, and they seriously limited diesel emissions. And they did first the no-cost thing by imposing on all their contractors a serious anti-idling, turn off your engines requirement. They had some teeth in it. They lost money. The contractors lost money if they didn't live by it. That was the no-cost option, and then they imposed on their next construction process actual point preferences for construction firms that were using vehicles funded by alternative fuels. In addition to that, when we came back from that meeting in Chicago, all three major hospital systems in central Ohio were all about to embark on pretty major construction projects. We passed along the Boston contacts and suggestions. I don't know if there were good reasons for rejecting those suggestions, but to our knowledge, nothing was done at any of those construction sites to limit diesel emissions. And for the next few years, every time I drove by and saw a line of trucks sitting there idling, you just want to slap your forehead at missed opportunities like that. So gentle suggestion, not criticism, but look for those opportunities.
Thanks. I could probably do without this, but since I have it, I'll use it. I'm curious to know, this is a question for James, about the geographic diverse expansion you talked about. I'm wondering what the strategic driver is and whether there's a sustainability component of that.
Those are higher level conversations than I'm privy to, first of all. I will say that I'm not, involved in the necessarily the strategy of why we're growing where we are. I know that in the UAE, it started with a significant family that was being treated, and then I think, that's how that started. London, we actually recently hired a new chief design officer, which is where sustainability rolls up underneath now. He's an architect from Foster's and Partner. He lived in London. And that was a big initiative from our former CEO, Toby Cosgrove, to go over there. There's a significant private healthcare market in London, surprisingly. I mean, they have the national health system, but again, I don't know why they're making those decisions, but sustainability itself, as we are expanding globally, we're looking into now making sure that all of our reporting is not just, US-based, that we're now getting metrics from these places is oftentimes even just difficult. We have sustainability managers lined up at both the UAE and in London. So, we're integrating in there, and it's definitely part of our plan. But again, on the strategy of why we're growing there, I really can't speak to that, unfortunately. So.
Hi, this is for Ms. Dial, or anyone else who has an answer. I think I heard you say very briefly something about healthy cleaning products. I'm very interested in that issue. What can you tell me? And how to find them?
So I think there are some standard certifications, like Green Seal certifications, and these are just for general cleaning. And we had a very good rep from the cleaning company that we buy our supplies from that was very knowledgeable. And the price differential was about, I want to say just for $11,000, we were able to convert to much better products for the environment. But I would be happy to, if you can give your contact, to send you the list of what we use and how they're certified. Yeah, and what those alternatives are. But in some of our like isolation wards and where we are worried about secondary infections, we have to use much stronger cleaning chemicals. But these are general purpose cleaners, just to make a distinction. Be happy to share that detail.
And I mean, I didn't hit on this topic. I guess we really can't hit on every topic in these presentations. But yeah, we have a green cleaning policy that we worked with our supply chain to develop that lists all of the green cleaning chemicals that EVS is allowed to use in specific areas. It's basically just a matrix, if you can imagine all the different room types and then really what they're allowed to use in there. Again, it does vary in some spaces for, I guess they need more intense chemicals to clean those spaces. But every time we do have a new contract that comes up, we sit on, there's really a council, an environmental sustainability council in our supply chain. So anytime a new contract comes up or, we're looking at rebidding something, we're definitely at the table, showing this is our policy, this is what we're looking at. So, we do have that. Yeah.
And our final question.
Hi. Is it working? Yes, maybe? Yeah. Okay. So in terms of your guys' number one recommendation for hospitals that maybe aren't doing very much or definitely not doing anything that's really would get them up on this stage to be speaking about it, what would you say your number one recommendation is as like an easy foot in the door, maybe to get some good savings or good recognition or something ahead of time, and that's kind of easy to convince people to go for? I don't know, LEDs or cleaning solutions or whatever that we could start with and then kind of help us get into the realm that you guys are in.
Yeah, that's a good question. I think most people, generally speaking, they care a lot about recycling. That's like the number one touch point. I mean, it's just literally what everyone thinks about so much. So I think if you can focus in on those streams, you can actually see pretty significant savings just by starting up a recycling program or a composting program. Or I mean, you'll see good metrics. I think though, where we've seen most of our savings, if you saw in that like chart that I had up there, 2/3 of it is really in energy efficiency. I mean, like that is where sustainability programs really make their ROI. And we kind of hit on some of those topics. It's LED retrofits, it's OR setbacks, it's looking at your VAV boxes and making sure that your air change rates aren't, really beyond what they need to be. I mean, it's really in the HVAC systems that you're going to see significant changes and significant savings. So I think those are the two buckets that really get sustainability programs off the ground.
I agree with James. I think recycling is people have such an emotional response to that. And the visual signal that it sends, people care passionately about it. But I tell you, we've been tracking the footprint for the university for over a decade. It's less than 1/10 of 1% for Ohio State. But it's the biggest sort of response that people have to it. From a carbon perspective, that's really minimal. But from a people perspective, that's huge. I would also say that if they're willing to dig deeper, you really need to think about your supply chain and what you're buying and where you're getting it from. Especially if, instead of thinking about doing things on the back end to clean stuff up or retrofit, why don't we get better products to begin with? So looking at having environmentally preferable purchasing policy and cutting it off the root, because that's where things flow into the organization, whether it's food or gloves or clinical equipment, just kind of doing it on the top end to say, how do we get better stuff to begin with so that we do no harm down the, does that make sense? If they're willing to take on a bit more.
And along those lines, one of the areas that I think makes a social impact and also an environmental impact along the recyclings would be pharmaceuticals. we've had significant luck, with doing pharmaceutical take-back programs. We have an initiative with our local vocational school where they actually built, drug take-back boxes that are located in various places throughout the community, and local law enforcement is involved. They're the ones that, check the boxes and, take care of the disposal. But, one of the things that really hit home in our community, and we're all dealing with it, with the opioid crisis, one of the things that our law enforcement was seeing was candy dish parties. And what was happening was, kids were going into, grandparents', medicine cabinets, taking, narcotics, taking other drugs, showing up to someone's house for a party, get a big bowl on the table and just dumping pharmaceuticals in, and then by the handful, and as a, father, that really hit home of how can that even be something that someone would think would be okay. But the more that we can do to get, unused medications, out of medicine cabinets and, out of the potential waste stream, I think the better off, you are, and it gains a lot of social impact as well.
Well, thank you very much. Big round of applause for our panelists. I really appreciate you taking the time to share with you. Did a very nice job of taking a very complex project. I mean, just seeing and understanding the backstory of sort of like all the data you presented. I mean, it's quite an undertaking. I think it's great for us to sort of like actually see what you're doing as well. I think for those of us that work in this field, don't really appreciate the sort of like scale and size of what you're grappling with. So we appreciate that. As is our tradition at the Environmental Professionals Network, we have a certificate of appreciation. I have to give Aparna a compliment. I think this is the third time she's been on our stage in her third different role. So she's gone from University Sustainability to Smart City Columbus to hospital. So Aparna, thank you very much. I want to move us along because we have another thing before we wrap up. I just want to note that we do have a future EPN in November. It's going to be on a Thursday this time, so just mark that on your calendar. It's going to be Yay Bikes, and the Mid-Ohio Regional Planning Commission is going to be talking about bicycling winterization and topics of that sort. I want to bring to people's attention too, we had Dannon for regenerative agriculture and soil health plan for November, but due to their travel policies, they're not going to be joining us until early in the spring. So keep note of the next meeting, Thursday, November 15th, and it's going to be Yay Bikes and Morpsey talking about biking programs. I also want to bring to your attention on the EPN YouTube page. We're excited that we're going to be rolling out a video toward the end of this week promoting that upcoming thing and being kind of a fun sort of treatment of biking year round. So look for that in the future. As a final piece of today's program, I want to, we're going to take about 10 minutes or so and have a presentation of several Ohio EPA Encouraging Environmental Excellence Award winners from our state's hospital sector. I'm going to hand the podium over to Dan Sowery, Assistant Chief for the Office of Compliance, Assistance and Pollution Prevention at the Ohio EPA to make those awards. So Dan.
So guess what? There's the point where you say, what?
What?
I really honked off my son. You guys ever see one of these little pop sockets? So I put one of these, we got one for our work phone. I put one on my phone and he's like, oh my God, Dad, you just made that not so cool. I'm ripping mine right off right now. And how did you get the Ohio EPA logo on there? Okay. That's not what I'm here for. Don't mind me. It's breaking things. All right. Thank you, Dr. Campbell. Thank you, Nolan, for inviting us. I'm here to present the E3 achievement for several hospitals. And you guys are all here, right? Yes. Everybody's here? You have the plaques? Okay, so the first, do you guys just want to come up and get the awards? Does that work? Yeah. All right, so the first is the Atrium Medical Center. Maybe you stand over here.
Okay.
We'll get out of your.
Prestigious group. That's pretty cool.
Thank you very much. Next, we have the Henry. Oh wait, no. Am I on the right one? The Henry County Hospital. Next, we have the Mercy Springfield Regional Medical Center. Next up is the Mercy St. Rita's Medical Center. Party foul.
We have 3 awards, so.
Okay, with that in mind, we're going to do Mercy St. Vincent Medical Center and Mercy St. Elizabeth Youngstown.
Yes, absolutely. We have 4.
Why not, right?
Why not? One last one, yes.
We'll shake again.
We'll shake again. Thank you. All right. Thank you. All right. We did well.
All right, next up is Premier Health Miami Valley Hospital. I punched this guy in the arm on the way in today.
Right where I had my flu shot.
Yes. I aimed well. Congratulations. It's nice to see you too.
Thank you.
Next up is the Ohio State Wexner Medical Center. There, you could have stayed up here. And lastly, but certainly not least, and I think I saw the gentleman over there, I'm guessing, Wright-Patterson Air Force Base Medical Center. All right, so a couple last things, just some shameless plugs about our program. So I head up the Office of Compliance Assistance and Pollution Prevention. What we do is we help businesses, communities, and other organizations stay out of trouble. We do it through confidential assistance. We can help you find ways to become more sustainable. We can find ways for you to avoid needing to deal with the Ohio EPA's regulations altogether. We also recognize for businesses, organizations, and other and communities for going above and beyond through our Encouraging Environmental Excellence Award program. One thing I wanted to tell you about, because actually it came to my mind when I was watching your presentation. We have an online dating service, if you will, for waste. It's kind of like eHarmony meets Craigslist. It's a little strange. But unlike Craigslist, where you can post materials on there and then you have some weird people show up and they want to barter like a arrowhead or something. I had that happen once, and I was like, I'm never doing this again. Weird. But we're actively behind the scenes trying to find ways for you to offload materials that you can no longer use. And it's called the Ohio Materials Marketplace. It's a free online exchange for businesses, communities. And I'm going to try to get this right. I think the web page is ohio.materialsmarketplace.org. Again, ohio.materialsmarketplace.org. Or you can go to a search engine and type in Ohio Materials Marketplace and you'll find it right there as well. Just as an example, there are a number of free materials on there right now. For instance, down in Cincinnati, there are 5,000 high-quality metal and wood shelves in all different sizes. And they're just looking for a business or any organization to come and pick these things up. They're not for homeowners, because I would already be out there picking up some of these shelves. But check it out. Again, it's a free online exchange on our webpage. And then lastly, and this is where I was really getting to what you had said, you had talked about balers, that you purchased a cardboard baler. So we have a grant program as well. It's a recycling grant program. The market development grant is up to $200,000, and it's 100% match, so we're better than Walmart. We'll give you 50% off basically for anything you want to purchase up to $200,000 that we would pay. So if it's $400,000 piece of equipment like a baler, and that could be for cardboard, it could be for shrink wrap or whatever it might be, we'll give you 50% off up to $100,000. And I think that's all I have. Any questions? All right, well, thank you for being a wonderful audience.
That wraps up our program for the day. We appreciate everybody taking the time and joining us today. We hopefully see you next month. Thank you.